The recent USAID funding cuts seem to have begun to frustrate critical health services, especially HIV/AIDS fight. Women rights advocates like Michelle Alum says even HIV prevention products, which had already been approved like pre-exposure prophylaxis and post-exposure prophylaxis, are not accessible to everyone nowadays. She says they are now primarily available only to pregnant and breastfeeding mothers.
We've been handling things to do with PrEP, things to do with PEP. We've been having new technologies like the lenacapavir.
She says many of these technologies were still in research trials when funding was abruptly cut.
When this executive funding cut came in, all these products were stopped, and we had most of them being done. Most of them were undergoing research in the country. We had a number of girls who were on trial for these products. We do not know what next for prevention research in Uganda, and even for the products that had been availed cannot be disseminated because they do not have authority to disseminate them, and because they have an expiry date, many of them are going to be destroyed, some of them are going to be taken back.
This has created a significant gap in prevention which could accelerate the spread of HIV. Professor Josephina Hichire, a gender studies scholar at Makerere University, warns that such cuts go beyond just budget issues. She says such cuts are like pulling the trigger on efforts to promote equity in health services.
Citizens must hold their countries accountable. In the case of Uganda, the whole arena of HIV financing, ARV manufacturing, government must take this mantle to take care of the citizens.
These women rights advocates and Women Pro Bono initiative highlight the need for intentional domestic financing of health systems, not as an afterthought, but as a central economic priority.
You cannot live with HIV without ARVs. You need your ARVs on a daily basis. And if you're not consistent, you develop what they call resistance, which means you must go on a higher line, a higher line, a higher line. So there must be continuity of supply of these drugs. If we don't have things like family planning that are available for women to use, we are going to have an explosion of births because women now can no longer control their fertility.
Because productive citizens, healthy citizens are inadvertently productive citizens.
Crispus Arinitwe, UBC News.